Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing today?
Doing quite well, thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines and U.S. COVID statistics through today, February 22nd. We invite you to submit any questions you have below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. We'll start with the COVID statistics. Average new hospitalizations per day, 3,029. In 2023, 3,788. Average COVID deaths per day, 175. In 2023, 377. New 2023 COVID vaccine uptake for adults, 22.3%, 65 plus, 42.2%, and children, 12.4%. Dr. Murphy, your reaction to those numbers?
Well, very similar to last week. It's still 175 people a day are dying in the United States. That's a plane crash per day. And remember, this didn't exist before. And over 3,000 hospitalizations per day across the entire United States. So it's better than last year, which was better than the year before, but it's still significant.
Mm-hmm.
And the vaccine uptake is creeping up a little bit. The highest risk group for complications, of course, is the 65 plus, and that's up to 42%, but that's a little bit more than half of what we get with influenza. People are taking the flu shot, but many of them are not taking the COVID shot, and COVID is actually even worse than flu. So people need to catch up, especially in the higher risk groups.
Mm-hmm. And we do have submitted questions this week. The first one is from an adult who is in that 65 plus group with a few health issues. They are completely updated and up to date with their COVID vaccinations. They got COVID for the first time before Christmas and took Paxlovid. Now they have a family member who has just tested positive for COVID. Are they safe from reinfection? Should they be, helping take care of this family member? And secondly, what is it about this new variant from South Africa? Is it an Omicron variant? Do our current new vaccines protect against it?
Mm-hmm. Well, it would be very likely for this person, even though they're at high risk, who's had all their vaccines, including the new one. The new one is as of September 2022. And recently having COVID, it would be very unlikely to get it again like right now. However, just common sense. Just take care of that person who's sick, but just wear a mask when you're together. It's really pretty simple. That's just common sense. And the same thing for the sick person. They should be wearing a mask as well. That'll help even more. As far as the new variant is concerned, it is an Omicron variant. And so the most recent vaccine should cover it quite well.
That is very good news. And we will, of course, look out for any studies that crop up about this. It is a very new variant, so we need to give researchers time to look into it, but we will keep an eye out.
Right.
In terms of our headlines this week, there was a very good study showing that there was indeed a lower prevalence of long COVID among COVID vaccinated people. Can you break down that study for us?
Yeah, so this is from the Annals of Epidemiology, and researchers from the University of Michigan, which has an excellent public health school, and they did a study in another surveillance study. Now, some surveillance studies, they have their limitations, but they contacted 4,695 participants and questioned them at day 30 and day 90. And they found that the people who were vaccinated of course, did much better. So overall, 32% of the adults with the COVID had 30-day long COVID. 32% had long COVID at 30 days, and 17.5 had it at 90 days. So that's a little bit higher than we have seen in the past, but the studies are also different. When they did all the adjustments for whether they were vaccinated or not, the adjusted prevalence, if they were vaccinated, was 58% lower. So, I mean, that's pretty dramatic. So it's just more data that adds to the other benefits of being vaccinated, not only preventing COVID, preventing severe COVID, preventing death, but preventing long COVID.
Absolutely. And staying on the subject of preventing harmful effects of COVID, there was another study that's been added to the growing collection of studies on Paxlovid use and its efficacy. Can you tell us about the results of this one?
Yeah, this is from the Journal of Antimicrobial Therapy. It's a British journal that covers all microorganisms that cause infections. It's published by Oxford University Press. I'm actually one of the editors of that journal. I do the viral infections, including COVID. So this is a nice study from the University of North Carolina in Chapel Hill. And they found that the use of Paxlovid, whether you're vaccinated or not vaccinated, had an 84% lower risk of hospitalization from COVID-19. So that's quite dramatic. Paxlovid really works, and whether you're vaccinated or not, it doesn't really make any difference. It's an antiviral drug. It's very potent. And it works, and you can stay out of the hospital and stay alive longer. And if you look at those patients who were treated with the Paxlovid, if they at least had 2 doses of the vaccine, like the original 2, it looks most of them were over 70 years of age. So they were really, pushing the envelope on the age risk factor. And a lot of those people, of course, had concomitant comorbidities or other medical problems. And it just adds to the growing body of evidence that Paxlovid prevents hospitalizations and severe disease. It's just quite dramatic. This is very important because as recently as last night, I got yet another message from a person I know whose sister had COVID. She's in her 70s. I don't know the history of it, if she has other medical problems or not, but she just qualifies based on age alone, if nothing else. And she told her doctor she tested positive for COVID, and the response was, "Oh, it has many side effects, and you don't need to take it." With this data about, you're talking about staying out of the hospital and staying alive in a drug that's been used now in hundreds of thousands, if not millions of people. And it's pretty well tolerated. There's some taste issues. There's some drug-drug interactions you have to be careful of, but the pharmacist or your doctor can explain those to you. But as far as like really serious reactions, it's very, very rare. And the treatment is only for 5 days. So if you can put up with this for 5 days, you get a lot of benefit.
Mm-hmm. And like you mentioned, the study adds to the growing body of evidence. All of the numbers that we've seen in this study have been, 84%, up in the high 80s. So just really great to see all of these studies finding similar results and really driving the point home.
And this is the nature of the beast. As time goes on, we just get more and more data. And it's all going pretty much in the same direction. You'll get like one study that doesn't show it, but you have to look at the entire body of evidence that supports this. And when you do that, it's quite clear that this antiviral drug combination works quite well.
Mm-hmm. Now, moving on back to the COVID vaccination area, we've talked a lot about underlying diseases and how you have to be careful with some, with the vaccines, but how really those who are immunocompromised should go forth and get their vaccine. There was a big study released showing that COVID vaccination was not linked to systemic rheumatic disease flares. Can you tell us a little bit about what that is and what the study found?
So rheumatic disease and rheumatic arthritis and these associated diseases, there's always a risk of having a flare-up, a period where it gets much worse and you could become even more disabled. And people were really worried that the vaccine could stimulate one of these, what they call flares. The arthritis community understands this terminology really quite well. So this is an encouraging data set that looked specifically at people with rheumatic disease. The study has 434 patients, and they looked at flare-ups at 2, 7, and 14 days after COVID vaccination, and they didn't find anything. So there was no evidence that the COVID vaccines were related to any of the flares. People do have flares, and they can happen if you're vaccinated or not vaccinated. It can certainly happen if you get full-blown COVID. And then one kind of interesting little quirky thing they found was that during this the 14-day look-back window, they found significantly fewer flares after the second dose of the COVID vaccine. So that was, not only did the second dose not cause a flare, but actually they had less flares. I don't know how to explain that, but it's certainly not making things worse.
Mm-hmm. Very positive news
for people with arthritis.
Mm-hmm. Now, one of the other big three that we have been talking about for many, many months is influenza, the flu. While we are fading past the seasonal peak, it is still hanging on in some areas. Can you take us through the latest data?
Yeah, there's overall, if you look at the entire country, the number of flu cases are going down, but it's very, very regional. Katie's putting up a map now that shows the high risk versus low risk areas. And the lighter the color, the light green and yellow are low, and green are low, but the red and dark brown are high. So you see some states like Ohio, South Carolina, New Mexico, Wyoming, Texas, Oklahoma have still very, very high rates. And some of these are like in pretty close proximity to each other. Like look at Illinois, which is actually doing pretty good. And you have Iowa that's bad, and Michigan that's bad. Ohio is very bad. So it varies. The point is there's still a lot of flu out there. And flu can be incredibly disabling. You can end up in the hospital, and you can die from the flu, and kids can get it and they could die. I mean, it's a well-known problem that we have the vaccine. More people have taken the flu vaccine than the COVID vaccine, and there is a treatment. There's several treatments for flu. So if you get the flu, there can be problems. Now, in the future, right now, people will go on and test for COVID if they can get their hands on a test, even though they have to buy the test themselves. But in the next season, so in the late fall, early winter of 2024, the tests that you will see in the pharmacies will test for both flu and COVID, and some of them even for RSV. So you'll figure out exactly what you have, and then you can take the appropriate therapy. Right now, everyone, you can go get tested, that's fine. But typically the test, you have to be in a hospital setting. You can't do it just from the pharmacy. So, people say, oh, I'll just live with it, do that. So, but next year you'll be able to easily make the diagnosis yourself. So that's good news.
Another topic that we have talked a lot about in recent months is RSV and the RSV vaccine. We've now heard news that the FDA has accepted an application from GSK to approve Arexvy, that vaccine, for a new age group. Can you break that down for us?
Yeah, so the big problem with RSV, respiratory syncytial virus, is that it causes very severe disease in kids under a year old, and can be very severe and life-threatening in people over 60, and in people who are immunocompromised, like have an organ transplant or they have some kind of cancer, but with a severe immune deficiency. So for those people, it's quite bad, and it can be really very serious. So I took my RSV vaccine yesterday, by the way. So anyway, I didn't have any problems. They have also studied it in people 50 and over. So they have done like many large numbers of patients, and they found in the preliminary cut of all this data that the efficacy was quite good. It ranged in the way you measure the efficacy rate anywhere from 67.2% to 94%. So it's really good. There's less disease in that group unless you're immunocompromised, but it's just widening that scope a little bit more. But definitely, if you're 60, you could do it. Kids don't take the vaccine. They take a monoclonal antibody, or you vaccinate the mother. You vaccinate the mother in the second trimester, and the mother makes the antibody. That goes to the kid. The kid gets protected. So that's the other group that does take the vaccine.
Mm-hmm. And moving on to more global diseases, we've talked about dengue and a lot of mosquito-borne diseases in the past few months. But now the country of Brazil has been warning about a very large dengue crisis. Can you tell us about it?
Yeah, so dengue, it turns out, goes in these kind of 4-year cycles where like every 4th year or so, they have a big spike in the number of cases, then it goes down and it pops up. So anyway, the PAHO, the Pan American Health Organization, has said this year alone, 2023, there were 4.1 million dengue cases, and this year it's even worse. And the Brazilian health ministry warns that they're going to have 4.2 million cases in Brazil alone this year. So that's a lot of dengue. So most people that get dengue don't even get sick, but 5% get sick, and 2 to 5% of them that get really sick die. So it can be quite serious. So dengue is spread by a mosquito, and it's a summer disease. So what the problem here is that South America is loaded with dengue right now. So there's big outbreaks in Argentina, Uruguay, Paraguay, and Brazil, of course, that I just mentioned. And then as the weather gets warmer, that is likely to pop up here in the United States, Florida, Texas, California, Puerto Rico could get hit. It's in the Caribbean already. And they're starting to report more cases than usual. So Florida reported its highest ever number of locally acquired cases in 2023 with 168. So, it's in the hundreds. It's not thousands or millions. But the problem is they're increasing. And this year could be even worse.
Absolutely. Something we will keep our eyes out for, something that we are constantly keeping our eyes on, but definitely big news coming out of Brazil.
Yeah, it's so big there that there are some vaccines for it, and they're giving those vaccines in Brazil now. We don't have them approved here, but we'll see how bad this is really going to get here.
Mm-hmm. Now, lastly today, there is a very tragic case. A man in Alaska has died in the first fatal case of Alaskapox. Can you tell us what Alaskapox is and a little bit about this case?
Well, I didn't even know about Alaskapox. I heard about this. I said, oh my gosh, another pox disease. So it's not very common. It's spread by rodents. There's only been 7 confirmed human cases. That's a confirmed case, so it's very difficult to confirm it. So there's probably a lot more. but 7 cases since 2015. And until then, people got a skin lesion, they got swollen lymph glands, they got muscle or joint pain. And then this person who lived a little bit further away from not Fairbanks, but Anchorage, where the other cases were mostly reported, this person got sick. He was had underlying illnesses and stuff, and his symptoms just got worse. And they think that maybe he was exposed from a cat who had come in contact with the rodent and spread it, like from the claws. They don't know if that's for sure or not, but that was one of the things. But just another weird virus that's out there. And if somebody got sick and had some lesions, they were recently in Alaska, this would be part of the differential diagnosis.
Absolutely. Not something the general public needs to be super worried about. However, it is good from a diagnostic perspective, as you said, for, medical professionals to be aware of what might be out there.
I think the people in Alaska are probably very aware of it. But people travel so much now. Somebody came from Alaska saying they had some strange skin lesions and were sick. That would be another thing to be concerned about.
Absolutely. Well, on that note, Dr. Murphy, thank you very much for your time and expertise, answering viewer-submitted questions, reacting to the COVID headlines and public health headlines, and breaking down those COVID numbers. It's much appreciated.
Great. Well, thank you very much, Katie.
Thank you all for joining us for this week's episode of the Ask Dr. Murphy series. As always, please submit any questions you have down below via email or any of our social medias linked in the description. Thank you and have a great weekend.
Great. Have a great weekend.